So hi everyone, welcome back to Ask Physiotherapies. I am flying solo again tonight, no Wally. Hope everyone had a good Monday, just not long in from work. And we're going to try and tackle some of your questions. So this is episode 7, I think, of Ask Physiotherapies. We hope you're enjoying them and finding the information helpful. As always, if you have any questions, you can send me a private message. I have my laptop open here on our Physiotherapies Facebook page. We did put out a post earlier in the week, and we said at the end of last week's video that we were going to do a little focus on women's health, seeing as I was on my own. So yeah, last week we said, because I was on my own, that we were going to do maybe a women's health spin on it, and it's been great. We've had quite a few questions in, so I'm going to try and tackle some of them. But if you do have any questions, and it doesn't have to be about women's health, it can be about anything, just send me a private message and I'll do my best to answer them. So let's crack into this. The first question is one that several people asked. So I just want to say thanks to everyone that sent in this question. It's the fact that so many people sent in a similar question tells me that this is a major problem, and we do see it in clinic a lot. So just to be clear, there's a whole specialty in physiotherapy outpatients that treats women's health issues. So what I'm talking about here is things like incontinence. So women starting to notice that they're leaking. This can be postnatally after you've delivered, or it can be postmenopausally, or any time in between. So any type of leakage, it might be from little drops to actually flooding and not being able to stop it. The other thing that we often see is prolapse. So this is prolapse of your pelvic organs. We can definitely help with that. Overactive bladder is another one. So you mightn't be incontinent, but you might find that you're running to the toilet a lot. All of these issues, physio can help, women's health physio can help with. So in our clinic, we see these conditions all the time. So, but still some people are not aware that we can help. So this is going to hopefully help a few people out there. So the gist of the first question, and again, send in any if you have any more for me or comment below. The first question, the general theme of it, so there was a few people that said that they do some type of activity and they're starting to leak. So one example was that this lady has gone out for her walks and she's noticing that over the last year she started to wear a little panty liner, and the panty liner is getting damper and damper when she arrives in from her walk. And a similar problem, but in another question, was a younger lady who's not long after having her third baby, and she is noticing if she gets a fits of giggles or if she's rushing. So an example is if she had to run across the road, suddenly she's leaking and she can't hold it in. So these are two different people. So the first lady was slightly older, and I did actually send a few messages back to get a bit of context on these questions, so thanks for answering. The first lady is closer to 70 and finding that she's getting wetter with her walks. The younger lady is in her 30s, has had a few children, and now she's 6 months postnatally and she's leaking. She still doesn't have that control back. And both these situations, the women are suffering from something called stress urinary incontinence. So they were asking, is there anything I can do? And the very simple and quick answer to that is absolutely yes. You should not be at any age suffering from incontinence and accepting it. It is completely treatable. So what stress incontinence means is we have our bladder, and our bladder normally, when it functions, it fills up, and we have the strength in our pelvic floor to keep the little tube, the urethra that comes from the bladder and brings the urine out, to keep it closed. So normally the bladder fills, we get an urge to go to the toilet. We can usually control that urge. You know, most people can control it for maybe 30 minutes, even up to an hour before they would empty their bladder. When you empty your bladder, your pelvic floor relaxes slightly, your bladder contracts and it squeezes the urine out. The tube stays open and the urine can come out. What happens with stress urinary incontinence is that your bladder has got urine in it. Something will increase the pressure in the bladder. So if you run, if you cough, if you sneeze, if you start to laugh, all of those things increase the outside pressure going on the bladder. So it basically squishes it down slightly. If you have a weak pelvic floor and you can't squeeze tight enough to catch the bottom as the pressure comes down, you'll leak. And for some women it might be a few drops. For some women the whole bladder might empty and they can't control it again. But effectively, if you do something that increases the pressure on the bladder and you can't keep that tight squeeze closed and a bit of urine comes out, that's called stress urinary incontinence. Now, the reason it can happen after childbirth is usually down to the fact that there has been some type of pelvic floor disruption during childbirth. It normally happens after a vaginal delivery, not always, but normally. And there may be a degree of maybe tearing, or they might have had an episiotomy where they had a little cut, so the pelvic floor integrity was disrupted and now they don't have the control afterwards. But that's combined with the fact that there's been an increased pressure on that pelvic floor over a 9-month period, and maybe they haven't been able to get their strength back afterwards. Lots of people, however, will have their babies and have no problems, but the problem will come later on when they're generally around menopause age. And what happens here is the tissues that hold up our bladder, the ligaments that hold the bladder up in a nice elevated position. As we get older and our skin quality changes, our tissue quality changes, like our skin gets a little bit droopy, so too does the ligaments that hold the bladder. And that, combined with the weakness in the pelvic floor, because it isn't as strong when we hit menopause, means that you start to leak during your sort of 6th, 7th, maybe even 5th decade, depending on where you hit menopause. But it's usually the ladies that hit menopause have also had vaginal deliveries in the past. So it's a combination of early changes to the pelvic floor from childbirth plus the changes of menopause that lead to the incontinence. So that's a long explanation for what effectively is stress urinary incontinence. And what we do in this case, your women's health physiotherapist will do a thorough assessment to make sure that there's nothing else going on in the background and that there's no overactive bladder. If it's a pure case of stress urinary incontinence, the first thing, and what the clinical guidelines tell us we must do as women's health physios, is assess that pelvic floor. Now, in an ideal situation, this would involve an internal examination, which is not the most pleasant, but can I tell you the information that that gives me as the clinician to give you a thorough exercise prescription plan is massive. I can see if you've actually got the technique, and if some ladies are uncomfortable, I don't even need to touch anything. I can just look and see if they're activating their pelvic floor, and then I coach them through. So I first of all assess, see if they can do the contraction, see if there's any lift or elevation, see what their technique is like. So the first part of treating your stress incontinence is getting a thorough assessment, because there's no point in just starting to squeeze and lift simply because you don't know if you're doing it right and you don't know what level you need to be working at. So for most of my ladies, from the assessment, I'll figure out, right, can they do the contraction? If they can, great. Then I see how strong it is. How long can they hold it for? How many repetitions do they do? And based on that information, I give them their exercise prescription. Now, if ladies have an active pelvic floor contraction, then again, the studies tells us their treatment should be active pelvic floor contractions. So if somebody has got a good strong pelvic floor, these Kegel machines, these stimulation machines where you use an electric probe, they're not indicated. They're only indicated if there's no activity down there. So if you've got a pelvic floor contraction, you've got to use it. That gets it stronger quicker. So what is a pelvic floor contraction? Well, the easiest way to describe it is to think about what you would do if you were to imagine yourself, first of all, stopping yourself passing winds, where you're squeezing that back passage in, and then you bring that round the front. Imagine that you're stopping yourself going to the toilet. So it's a very intimate contraction. Your pelvic floor is that big muscle that wraps underneath between our legs. So you squeeze from the back, bring it round the front, and you think about lifting that pelvic floor up, up, up inside, and then relaxing it off. And I would give my patients repetitions of that depending on where they are. So I would get them to squeeze and lift and then relax. And then I would get them to hold, where they would squeeze, lift and hold. And again, based on the assessment, I would decide how long they would hold for. So, you know, an average prescription might be a combination of long holds, where they maybe hold their contraction for 5 seconds and do that 10 times. And then quick contractions where they squeeze and lift and then relax. And how many I give will be based on how quickly they tire. The other thing that I do with my stress incontinence patients is I get them to use something that we call the knack. This is where you squeeze your pelvic floor before you're about to do the activity that you know is going to cause your incontinence. So if you leak when you cough or sneeze, then when you feel it coming on, you squeeze and lift that pelvic floor tight before you cough or sneeze. Or if you leak when you lift the laundry basket, squeeze and lift, and then lift the laundry basket. The one mistake that ladies make when they come into me, they say, I've been doing my pelvic floor contractions, and I check their technique, and their technique is pretty good. And then I ask them, when do you do them? And they say, I do a few now and I do a few again. And then I found their problem. Your pelvic floor is like any other muscle in the body. You've got to do it as an exercise prescription all together in order for it to get stronger. So there's no point if you wanted bigger arms doing 5 or 6 bicep curls now and 5 or 6 again. Your bicep would never get any bigger. You've got to do these exercises all together in one session and until you've fatigued it in order for it to get bigger. So the question here was there anything I can do to stop this leakage for when I'm playing with my kids or when I'm walking? Absolutely, 100% yes. It will usually be some form of pelvic floor muscle strengthening, but what kind of exercise you do are going to depend on your own ability. When people get stronger, then we combine it. We get them to squeeze their pelvic floor while lifting their bottom off the bed, or while doing Pilates-based exercises, maybe lifting one leg up and squeezing their pelvic floor and bringing it back down. So there's a whole combination of exercises we can use to challenge it. But a good assessment by a women's health physiotherapist will get you started. So yes, there's absolutely something you can do. Okay, God, when Ollie's not here to tell me to stop talking, it's not good. The other question then was on a similar theme but slightly different, and I'm just going to go through this one because it's a bit more specific. So this patient has actually gone through something with their back. So our bladder is innervated by nerves. Okay, that's how they work. So we have our spinal cord, and out of that comes big nerve roots, and these nerve roots go down and they innervate our bladder. So this patient had problems with their back and had an operation for a disc bulge, and they said that the night they had their operation, they were bursting for a pee, but only a few mils came. So they inserted a catheter, which is a little tube that they put into the bladder that empties it passively. And her bladder was full. So something had gone on here with the nerve ending. So she was bursting for a pee. She knew she was bursting for a pee, but she couldn't get it out, which meant that there was something going on with the nerve ending. So usually when we contract our bladder, our pelvic floor automatically relaxes, which allows the urine to come out. Likewise, when we contract our pelvic floor, our bladder relaxes, which keeps the urine inside. So something was going on with this switch mechanism after the surgery, which can commonly happen because the nerves at the back innervate our bladder and our pelvic floor. Since the operation, my pelvic floor is very weak. I can slow down my urine stream, okay, that's really good, but can't stop it. So this is called a stop test. Again, another thing that some patients say is that they do their pelvic floor exercises while they're going to the toilet. Now, we do not advocate that because your bladder is a very sensitive organ. It will adapt to the signals and the messages you give it. So if you're doing the stop test while you're going to the toilet all the time, so if you're stop and starting, you're confusing your bladder, because when you contract your pelvic floor, your bladder relaxes. So then it thinks it's done going to the toilet even though there's still urine in it. So the stop test is a completely fine way of checking your pelvic floor strength, but you might do it once a month. It's not something you would do every day. So you can check once a month, can you stop the flow of urine? And that will tell you kind of where your pelvic floor strength is at, but it's a once a month thing, it's not an exercise. But the fact that you can slow down the stream means that the nerves to the pelvic floor are working, and this is a strength issue that's going on rather than an innervation one, so the nerves are recovering from the surgery. When I have to go for a pee, if I don't go straight away, I could easily wet myself. I have been doing my pelvic floor exercises, but I feel it is very weak and shaking. I can't hold the lift. What can I do to improve this? Okay, so whereas the previous example was a stress urinary incontinence where they didn't have the strength because of the weakness from either menopause or from a vaginal delivery, this pelvic floor is weak because it wasn't getting the nerve innervation post-surgery. So the pelvic floor wasn't squeezing tight enough because it wasn't getting the nerve stimulation into it. So this patient is someone, again, who needs really to be assessed, because if there's no contraction going, this might be a patient who would be suitable for internal stimulation. And this is where we use a little probe that just slots inside, and we use a little, like a TENS machine nearly, to stimulate that pelvic floor muscle contraction. Now, if you've got a contraction, and it sounds to me like you do, because if you can slow your stream down, that means something is happening down there. I would say you need to just stick at it. And what I would say is you need to just sort of review how you're doing your pelvic floor exercises. So for someone who's got a weak pelvic floor, the ideal position is on your bed with your feet bent up, so that your knees bent up, your feet are flat on the bed, so you're in sort of crook line, if you want to Google that word. So you're on your back, and the feet are just slightly closer to your bum, so your knees are bent. Completely relaxed, the door is closed, nobody's distracting you, and you're just focusing on the quality of that pelvic floor contraction. And this is where I say, you really squeeze from the back, round to the front, pull it up, and then relax it off. And I would start to say, if you're struggling with the hold, then only start with 2 seconds. Squeeze and lift, hold, 1, 2, relax off. And for a week or 10 days, that's all I do. See how many you can. I mean, if it's 8, great. You do 8 2-second holds every single day. This day next week, can you do 10 2-second holds? Then can you hold it for 3 seconds? And really, it's persistence and hard work, and that pelvic floor will start to change over time. Once you start to get a little bit of strength in it, then you hold for longer. Can you do 10 repetitions but hold for 5 seconds, for 6 seconds, for 7 seconds, and then up to 10 seconds? That's what you're looking for. But at the start, don't worry. You might do 2 or 3 really good ones and then it flickers off. Just keep working, squeeze and hold, and it will get stronger over time. Once you've got the technique then in crook lying on your back, you can start to challenge it. But really, usually my ladies are doing that for a month before I would then have them come into sitting and try to practice it in sitting. Or I might keep them on their back and do it with a little bridge, where they squeeze and lift their bum up, place it down, relax off. So all of that would go on before I would ever have them doing it in standing, because as soon as you stand up, all of the weight from your organs pushes down on your pelvic floor, and it's much harder to lift and hold. So I think that this patient is on the right track because they can slow down their stream. If you can slow it down, something is happening down there. So use that as your stop test only, not as your treatment. Get on your back in the bed and just focus on quality pelvic floor contractions for at least 10 minutes every day of squeezing and relaxing. If you're not sure and you feel like you're disheartened and you're not getting anywhere, I would encourage you to get your chartered physio and have an assessment, because a lot of women come in thinking they're getting nowhere, but actually based on the assessment we know that they're making progress. We can feel it, we can see it, and that really then encourages the patient that they're going in the right direction. And a lot of people, even though they feel like the internal assessment, they'd be mortified about thinking about doing it, but actually they come back saying, oh, will you check for me? Because it gives them that feedback that they're actually getting somewhere. I have somehow managed to talk for 20 minutes on incontinence. I really love this topic. Like I went and did my women's health training because in Donegal there was like a huge, there was nobody really in the private sector providing the service. And yes, there was options in the public sector, but people had to go on a waiting list and they did go talk to their GP. And since we offered the service, it really amazes me how much we can help and how much you can actually make a difference to people's lives by helping them with their continence problems. This patient also mentioned, that they feel like if they don't get to the toilet quickly, it's going to come. So that overactive bladder, where patients feel like if they don't get to the toilet, they're going to wet themselves, so they're running to the toilet again and again and again. Like that takes over someone's life, and they're plotting everything they do around where the next toilet is. And they'd be petrified about getting on a bus where they wouldn't know where they can get off. And with those patients with overactive bladder, we work on something called bladder retraining, because you can retrain your bladder to calm down. And that really gives people, a sense of independence back where they were before, attached to the nearest toilet. I could talk about it all day. What my key message here is really about finding someone that can help you. So ask your doctor, ask your chartered physiotherapist if they know of any women's health physios. We provide the service in Physio Erin. I know that Lorraine Boyce provides the service in the Letterkenny area. So, you know, there is physios out there that can help. So just ask for help. That will be my key message. We're after getting another question in there around leg cramps, so I will divert that on to next week, and we will we'll go back to our normal physio topics next week. I hope you find that women's health stuff helpful. If you have any other further questions or want any information, do not hesitate to contact me directly, because I know this is a sensitive topic. So yeah, hopefully that helped. So that was Ask Physio Erin, all about stress incontinence really, and pelvic floor muscle strength. So yeah, that's another episode done. Hopefully we'll have Ollie back next week. Otherwise, have a great week, and thanks for watching. Bye.